On September 8, 2022, Queen Elizabeth II died at the age of 96. The impact of her death has been clear from the responses across the world. The British government decreed 10 days of mourning, and similar initiatives were taken in other countries. The Queen was highly committed and worked almost until the day she died. She had the longest reign in the history of the British monarchy. People have been concerned with her health over the past months, and now the international media wonder, what did Queen Elizabeth II really die of? At the moment, there is no official statement on the cause of her death. On the night of September 8, it was simply announced as follows via social media: the Queen died peacefully at Balmoral this afternoon. Despite her advanced age, Queen Elizabeth II was in very good health until only a few months ago. Her medical history does not include any chronic illnesses, only a bad case of the flu in 1993, a broken wrist in 1994, knee surgery in 2003, gastroenteritis in 2013, a bad cold in 2017, and a back injury in November 2021, according to several British media. Following the death of her husband Philip, the Duke of Edinburgh, in 2021, the Queen increasingly withdrew from public life. In February 2022, she caught COVID-19, but the royal family declared that she only had mild symptoms. Yet, according to the BBC, the Queen said in an interview that she was very tired and exhausted after having COVID. In fact, in the last months of her life, she was seen walking with a cane, she weighed less than usual, and she cancelled several important appointments, such as some of the events scheduled for her Diamond Jubilee. Still, Elizabeth II's death came as a surprise to many. On the day of her passing, the palace confirmed that the Queen's doctors were concerned and had recommended medical follow-up, but it did not suggest in any way that her condition was critical. Ginny Mansberg, an Australian doctor, explained on the Australian television Channel 7 News that the Queen probably did not suffer in her last moments because she fulfilled her tasks until the end. Heart disease and stroke could be the cause of death, Mansberg explained. She could have had a stroke. She could have had a heart attack. 2 days before her death, at the time she received Britain's new Prime Minister Liz Truss, some public attention was focused on the blue-colored mark on the Queen's right hand. No one imagined that this would be the monarch's last public appearance, but the mark did strike observers. Australian Dr. Deb Cohen-Jones told the Daily Mail that the blue-purple spot could be a sign of vascular disease. According to the doctor, the condition can lead to heart failure or multiple organ failure because it causes blood vessels outside of your heart and brain to narrow, block or spasm. Another theory proposed by various doctors is that the Queen suffered too much from the loss of her husband. The so-called broken heart syndrome is an acquired myocardial disease, a sudden dysfunction of the left ventricle, which is triggered by stress or severe pain. Dr. Deb Cohen-Jones told that the syndrome is not just about losing the will to live. It has real effects on one's health. Physiologically, losing the Duke of Edinburgh would have caused severe stress, which would have risen her cortisol levels. Additionally, the scandals surrounding her son, Prince Andrew, and Prince Harry's departure from the royal family were also huge challenges for the head of the British royal family. We may never know the exact cause of her death, but there will be ample opportunity to remember the Queen and pay respects. After lying in state for 4 days, enabling the British public to say goodbye to her, Queen Elizabeth's funeral takes place on Monday, September 19th. Media from around the world will broadcast the last farewell. Queen Elizabeth's final resting place will be in St. George's Memorial Chapel, alongside her husband, the Duke of Edinburgh.